next week. So today's presentation is I'm going to hand it over to Anwar, and then you're welcome to have your questions about AI and how you think that it will or won't improve healthcare in the future. But Anwar, would you be ready to kind of take on your presentation right now?
Yes, I hope everyone can see the slides.
We can
I've
see
shared
the
the
slides,
screen,
Anwar.
so thanks for the introduction. So as Jacqueline said, I will because I will talk about the overall big picture and then also share some of the specific things that we are trying to do in applying AI to healthcare. So in terms of some of the things that I will present, it's part of, now it's a big group because I have been working on this in Pakistan, and then also in Florida I had some collaborations and links as I worked there for 1 year, and also working with NIH. So there are different different stakeholders who are in clinical practice, in computer science and engineering, and at different stages doing something in this field. So I will just briefly go through. So this is the kind of thing that we hear these days, that artificial intelligence is beating doctors at diagnosing diseases. It's a thing that has been coming up for the last couple of years. I put this statement here to talk about it because it's always about some specific things. So maybe a specific set of data like breast cancer, brain tumor, where we see these statements. So important thing here is diagnosis is still a very big thing, and it can incorporate a lot of different kind of data, saying up to a patient that you have tumor or something like that is a very big thing. And just by looking at a couple of MRIs or a train network can be dangerous. So it's still, although we see this, but it's still on a certain collection of data. So we have to be careful about this. But the very important point that we see as data scientists or computer scientists is that in healthcare industry, this is a stat from 2019. The amount of data that is generated is increasing by 48%. And this number, 48%, is expected to grow as we go into the next years, because the amount of data is always increasing from different sources. So obviously, this puts a lot of burden on the people who are looking at this data. So for example, the radiologists that we work with, they are always, they have the amount of readings that they have to do is always much more than right now, is much more than what they can do. And in different scenarios, like maybe in US, in Pakistan, the amount of expertise that people have and the amount of time that they have. So there's a mismatch in terms of data and what is being done. So this is these are some predictions from World Economic Forum. And these are, again, all latest, predicting what's going to happen in 2030. So in these 3 points, there are 3 important things that we look at. So the first point, by 2030, AI can access data from multiple streams and aid in treatment. So the important thing here is that it's talking about data coming from different streams. So it could be what a doctor, when they meet a patient, how they take the notes, or like different question answer things. So text-based information, MRI scans, anything that comes from radiology, different lab tests. So it's a kind of, technically speaking, it's a kind of multimodal data. So, and every data has different dimensions and representations. And this is one of the challenges that we also try to solve right now. For example, you can have data from text, you can have data in numbers, like maybe you have an ECG which just represents a random collection of numbers. Maybe to doctor it has some meaning, but as a data scientist, at looking at it straight away, it's a random collection. And then you have images that can be 2D, 3D, a lot of different dimensions and sizes. So a single system that can uh, go through all this data in a uniform and coherent way, that is a challenge. So that's the first point. The second thing is it will be able to predict certain risks that are specified to a certain individual. So for for example, talking about myself, what will be the right diagnosis for me? It might be different from another person. For every person, there is something different. So we talk about personalized and precision medicine. So how we can train these models that just don't see certain images and give you that it's a tumor, how it will be able to predict something specific for a certain person. Personalized medicine is something we are looking at, and here comes explainability and how you can explain what this AI system is diagnosing, what actually a doctor does. So looking at different things, they come up with a specific diagnosis for a certain person. So that is a direction AI needs to move in, and we are working on that. And the third one is what I believe is one of the things that is the most successful part of what AI has been done right now is allowing people or allowing hospitals uh, to schedule how the patients are how the patients are assigned to doctors or MRI scans and things like that. So it's more like a scheduling system. Just some numbers here in again from 2019 and 20, we can look at how big this thing is. So for example, in US, the spending on healthcare is 3.6 trillion. And by 2035, we are going to be short of 12.9 million skilled healthcare professionals. So if we hear these terms that, or if sometimes we hear from doctors that they might lose jobs to these AI-based systems, this is a very good representation that we are already short of these people. So they are not going to lose any job. They actually have to rely on this AI. So just a few numbers to put it in perspective. And I found this interesting observation is from Philips Singapore, and they did this survey. And very interesting thing is that already 55% of the healthcare professionals, they are somehow using AI in their system. So it could be the hospital system that uh, does appointments, or some Philips or different machines that work to do radiology, sort of pre-processing of the images that they do once they generate an image. And on an average for the 15 countries that they study, it's 46%. So that is a positive aspect. And the percentage of healthcare professionals who thought that they have, who are fearing in terms of job security, the numbers are quite low. So at this point in 2019, it's a very recent survey, so we can see a, a shift in trend of these healthcare professionals going towards AI, which from my experience working in this field for the last 4 or 5 years, I think maybe 2017, 18, these numbers would be much higher in terms of job fair. So based on this overall picture, I just want to share some of the things that I do. So one of the main problem that I would like to talk about here is as I said, we are talking about data coming from multiple streams. So for example, we record the age, the normal procedure when you go to a doctor, you have some physical checkup, record your temperature, weight, stuff like that. But all these kind of things, sometimes we have a lot of data that is missing. If we talk about a machine learning system, we need data to have certain structure so we can learn something. So missing data and data with a lot of different dimensions, that is a big challenge in training an actual AI-based machine learning system. And in terms of imaging and radiology, there is a lot of, as I said, that radiologists have a lot of readings to do. So if we want to train our AI systems, we need data that is labeled so that we can train our system. So we can't go back to doctors to get those trainings. So this example that I am showing here, we are trying to make systems that can fill in these gaps by, if you have unstructured data, structure them. So you can learn better representations. And if you have some missing labels, how we can generate that. So the example that I'm showing here is what we are doing. AI is very successful now in generating data. So if you train it well, you can generate missing data. So if you look at the figure, which is numbered 5 here, a very interesting thing here is that you have an MRI, and out of MRI, this is an actual MRI from a patient. And what we do from that MRI, we generate a CT image. So we are going from one modality to another modality by using our deep learning based model. And what is the benefit of this? So this example is for fat segmentation in the abdominal region. And doing fat segmentation in abdominal region is simpler in CTs for radiologists than MRI. But the amount of information that we can get from MRI is far more than CT. So by doing this, what we do is convert MRIs to CTs. Uh, and because for CTs, we have certain label data, we have an artificially intelligent system that can, in a generative way, uh, segment fat in those synthetic CTs or the CTs that we have generated. So ultimately, what we will have is for MRI images where we have no labels, we can get the segmentations. So it is a very important problem for, let's say, if we don't have labels, what we are going to do. We can do these kind of generative models, and it's a very interesting application of AI and data science where we have these synthetic CTs and we get the results. So these generative models are kind of very successful right now. Just going away from simple segmentation and getting tumors done, we are going towards that direction where the missing pieces, we are trying to create that in our pipelines. Uh, Also, I just wanted to highlight some of the points that we are doing as the group that I talked about. So, these are things where we have very good results, and we think we can right now go from research to products. So, for Alzheimer's classification using MRI and different clinical data, we have very successful and very high, like high accuracies, and we believe these systems can be converted into systems that clinical experts can use in their practice. Uh, going and Alzheimer and this fat segmentation that I talked about, this is more related to imaging data. The second point that I have mentioned here is detection of human stress. So it's kind of again an application of AI where you have different data from sensors and you analyze that data to predict what kind of stress a person is currently feeling. So it can help in mental health issues, and they have a lot of different other consequences as well. And here, the specific thing is that it is related to physiological data. So you have uh, maybe data coming from brain in the form of EEG, not imaging data, in other words. Uh, Explainable AI, we are working a lot on this, and what we are trying to do is, in terms of statistics or probabilistic terms, how we can explain what we are diagnosing or what we are segmenting from our images. So it's more just not a binary classification of saying that this area is tumor or not tumor. We have interpretation how a clinical expert will do. So we are trying to, so once we have a trained system, it does not just do these binary classifications, it gives us other indicators as well. So like confidence, for example, if a certain area is tumor, are we 99% confident that this is tumor or not? So this is one of the things that we can get as explainable AI. And in terms of another stream of data that is very useful here, it's chatbot. So it can be a messenger kind of thing where you type something, and an artificially intelligent system based on the learning environment that they have, they will reply or interact with the person. Or it can be a line or a call where a chatbot will talk. We have these type of calls all the time where some computer is talking to us. So this can go towards social services where people want to interact with a system in a secure environment, and these AI-based systems can, because they can learn these things, they can in a secure environment interact, and maybe whatever the problem is, they can solve or interact with the person who is interested in that service. So this is, I will stop here, and I will, if you have, anyone has any questions or points, we can discuss.
Yeah, what I really like, thank you, Anwar. What I really like is you've really given us a broad scope. I can see that AI can be used in a variety of different ways. I have tons of questions, but I'm going to open it up for people online. Is there anybody online who would like to ask a question?
This is Kai. I've got a couple.
Okay, yes, please, Kai, and then we'll have Andrea.
Oh, good, thanks. A lot of very interesting information. Thanks. Just briefly, two items. One is I'm curious about how DICOM fits into what you're doing in terms of the tagging, the standardization across multiple modalities for doing this interpretation work you're doing. So one question is, how does DICOM fit into this? And is that helpful, or does DICOM have to change dramatically to actually fit with what you're doing? And then the second question is, to me, this would be exciting as a way of building a personal health record management system so that I could incorporate stuff from across multiple doctors and feed my own information into this system. Are you looking at this as a tool for the clinician to use to improve their work? Or is there a way for us as the patients and people to put our information in to be able to get a better longitudinal look at the data that we've accumulated over our health records to be able to see what's going on and maybe find things that our doctors are missing? Thanks.
Yep. These are interesting questions. So the first one, DICOM, a lot of the gap, although DICOM needs to maybe improve as I work on them. But the thing that computer science is doing a lot of, like, for example, the type of libraries that are now available in Python, not available 3 or 4 years back, they solve a lot of problems. So we have very good routines that just read data from either DICOM format or one of the format that is now more common in radiology is NE. Or not, so it's easier just to load the data into something that is NumPy array, technically speaking, and then we have those numbers and we can do whatever we like to do that with that. So I don't see it as a very big issue in terms of how the DICOM data is. But maybe when we talk about data coming from different modalities, and not in terms of the data that DICOM is storing, in terms of the headers and how the data is structured there, that might need some improvement to have some standardization of how things are coming from different directions. The other thing, it's a very interesting thing, and we have been working on this. On one side of the spectrum, we call this that a person should be, as a baby is born, the baby should be in a hospital. So we are getting data from all different sources as soon as a baby is born throughout his or her life. And then, so whatever we predict for that person is at the right time, and before something bad or a disease is going to occur, we are one step ahead of that. So if people are willing, this is one of the main bottleneck. If people are willing to share their data, maybe through their mobile phones as at different stages on daily basis or monthly basis, something like that, it will obviously aid the AI systems. So it's at that point in time, if we have a lot of people who are happy to share their data through all these things that we have all the times with us, we will be in a better position to train these systems.
Anwar, this is Charlie. We have a system where we'll have patients going into a self-service cabin, and we have them pre-register before they go in and indicate as much information as they can as to why they're there and what their personal symptoms are. And what I'm looking for is an AI package that could assist the medical person who's remote in this telehealth application to give them a better idea as to where they may want a fish and probe as to what the cause of those symptoms are for the patient, and speed up the triage and the assessment so we don't use as much medical time and dollars doing the diagnosis. Is there something you're doing that would help us in that regard?
Definitely, what kind of data you collect from this self-service system? Is it, are these surveys web-based or app-based? What kind of data?
It could be app-based, or it could be a check-in terminal, touchscreen, where they would provide their whatever they understand on their symptoms, whether it's pain, whether it's congestion, where those conditions may be in the body, and anything else we could ask them.
Yeah, so what I would say right now, this is, I have some work where in research we did this thing for a specific disease, that is heart diseases. So we targeted a couple of heart-based diseases and try to predict for those patients what they should be doing in terms of their lifestyle. So just a simple recommendation system. So we can build on that. We have, depending upon the data, if you, what I would say is, because this can become very complicated depending upon how much information you are going to use. So if you try to just do a prediction of or matching the right doctor or the right kind of, based on the symptoms that they're doing, this kind of prediction can be done. That kind of AI is available, yes.
All right, well, perhaps we could do something offline and talk about it more, but I just want to get some indication that there's potential there or not.
So Charlie,
Yes.
you have absolutely made my day, because this is exactly why we have these open innovation calls. In the chat, I've put Anwar's email address. So please, anybody who's interested, please note that down so that you can follow up. I believe we had 2 questions, and then we're going to probably run out of time. I believe Andrea wanted to ask a question, and then Nigel wanted to ask one. So Andrea, do you want to quickly ask a question?
Yeah, I'll just repeat what I put into the chat, but I'm just curious how much of this is being integrated into the medical school curriculum at this point.
So right here in Pakistan, in my university, I teach a course, medical imaging, and that because I am in an engineering faculty, so I have to deal with the engineering perspective of that. So developing AI systems or data science-based systems for these kind of things. So that's what we are doing here in UCF, where I was. Their medical school is running a system with the engineering program for doing data science and healthcare. It's not a degree right now, but they have certain students who try to specialize in this field. Either they could be in the medical school or they could be doing computer science. And one of the things that is interesting as well here, if you look at any, if you look at any online course on AI right now, on machine learning right now, you will see, I've been looking at those courses right now. So people tend to have around 2-3 lectures right now that specifically try to target healthcare problems. So we are going in those directions.
All right, well, I'm going to quickly move on to Nigel Sharp and see if he'd like to ask a question, but in case we run out of time, I want to say thank you, Anwar. That was just a fantastic presentation. Would it be possible to get a copy of your slides sent to me and then I can share those out?
Yeah, I will share it with you and also put my contact details. And anyone who wants, if you want to share with your people and they want to
Awesome.
contact,
Thank you so
I will
much.
be happy
Nigel,
to
do you
share.
want to take us out with your question?
Sure. Well, I've got a huge question for you, Anwar, so I don't think we're going to get it resolved, but I think I'll there anyway. You know, with how comes response, machine learning, there's a lot of power in the tools, and I'm really interested in, you know, as a technology developer and a researcher, how much are you spending time thinking about, you know, the concerns that this technology has around data privacy and, you know, the power change and flow that can happen from the companies who are eventually going to be owning and controlling some of these tools. And I'm really thinking in a non-socialized healthcare system like the US, where large corporations going to control a lot of the healthcare market. You know, any thoughts like that? Because I think there's a responsibility that fits into all of this, and how much of that is going into the thought and the work as you go forward and maybe look to commercialize some of these solutions.
Yeah, it is it is a very important thing, and because we are, I'm not now involved with a big group, so I did not put everything into this slide, but security and privacy is a very important thing. So like in telehealth systems, it is a problem if you are transmitting data. If there are network data security issues, what can happen?
I'm not talking about security. Security is a different side of it. I'm really talking about the power that comes from having access to all this information. You know, large companies who then know, you know, when people are starting to get sick, you know, the bigger company may be able to reach out in advance and try and get, you know, access to their doctors as opposed to some other competitors' doctors. And, you know, it's when technology meets real world commerce and business, interesting things happen, and you not always really great results. It's a interesting conversation that I know we don't have time to really expand.
Yeah.
But
Unfortunately, Nigel,
I appreciate that you guys taking it on. Thank you.
I'm glad you brought up those points, but we have pretty much run out of time. So maybe Nigel, you and Anwar can continue that a little bit offline. But Anwar, thank you again. That was an awesome presentation, and it was a joy to meet you in November, and I wish you great success. If there's anything that we at HealthTie can do for you to advance or help you, we would love to do that.
I hope to stay in touch, and anyone, I'm happy to talk to anyone who is interested later on because we are running out of time here. So I will share the slides and all my contact details. So whenever we can fit up and talk again.
Well, thank you very much. And thank you, community. This has been awesome. So thank you very much. And I'll see you all in 2 weeks when we have Etta Epidermis speak to us, and we'll be presenting from the Juno Innovation Summit.